All right, everyone, welcome to our CE webinar this evening, Understanding and Management of Oral Mucositis. My name is Dr. Kirsten Roling. I am a public health dentist here in Phoenix, Arizona. I was the chief for the Office of Oral Health for Maricopa County's Public Health Department, which is the third largest in the U.S. I'm excited to be able to launch this presentation with you all this evening. And again, if you've just joined us live, which is March 13th, 2024. You'll need the handout and CE credit instructions. Tap on the red banner at the top of the screen, or check your email, or review the instructions we have for you in the chat area. If you are watching this presentation later as a recording, to receive your CE credit, you'll complete a quiz. Simply drop below the video player here to the instructions section. Number 3 is the quiz. Number 2 is the handout. Any questions about how to get CE credit this evening? All right, gone. I would like to thank ioTech International, who are great colleagues and have been great supporters of our educational program. And this evening, following my presentation, you'll have an opportunity to hear from ioTech. They're rolling out a new product line for oral mucositis. And I understand that launch is going to take place possibly in a couple of months. So stay on with us to learn more. Not required for CE credit. They're going to be talking to you about all of their molecular iodine products and offering an attendee promotional discount. So if you can stay on, we'd love to have you. My conflict of interest and financial disclosure: I am the CEO. I am an employee of Dental CE Academy. I have not received financial assistance or honorarium for this presentation, and I have no financial affiliation with ioTech International. The agenda and CE credit instructions we've reviewed, but just one more time for those of you that have just joined us. Be sure to be here from 5 to 6. Following my presentation, we'll have ioTech speak to you about molecular iodine oral care products. You are welcome to stay on, but it is not required for CE credit. At 6:30 p.m., we are going to send an email to all attendees to complete a brief quiz for CE credit, and that quiz will expire in 7 days. Learning objectives are here for you, and I will be touching on all of them. I'm going to start the presentation by introducing you to my father, whose 87th birthday would have been tomorrow. He was a savant. He was a violinist, began playing the violin at the age of 4, and it's pretty hard to top that kind of a dad. But his goal was to really become an engineer. He was a mathematician. And he attended Penn State University on a full music scholarship at the age of 16. And he was truly a violin virtuoso. And if you see a resemblance, I hear it all the time: you look so much like your dad. All right, I do. But past that, his nickname was Young Nero. And he played the violin everywhere. It was really his outlet to meeting humankind. And along the way at Penn State, he met my mother. My mother was a cheerleader at Penn State. She's down there in the first row, second from the left. And I bring this up because at that time, this was the 1950s, and they both started to smoke in 1958 or something like that. And because of that, they both developed tobacco-related illness and both passed from their tobacco use. And this was at a time when 1 in every 2 adults in the United States smoked tobacco cigarettes. 50% of the adult population in the 1950s used tobacco products. Mom and dad were 2 of them. And unfortunately for my dad, he didn't survive the experience, and neither did my mother. My father developed lung cancer at the age of 67. And during that time, I knew he wasn't going to survive it. But I was unprepared for the unrelenting assault of oral mucositis on his quality of life. And I attended the University of California, San Francisco. So if we have anybody here who attended UCSF. You know Dr. Saul Silverman. We love him, and he's unfortunately passed. But he was my oral medicine professor, and I was able to do a postgrad program with him as well. And he was a specialist in oral medicine, oral cancer, and certainly quite prolific in his publications of oral mucositis. So when Dad became ill, and I realized that oral mucositis was really his primary issue as well, I contacted Dr. Silverman. I said, Dr. Silverman, what can I do for my dad? You know, he has horrible oral mucositis. He's not able to eat. He had multiple hospitalizations for tube feedings and, you know, malnourishment, electrolyte issues, dehydration, and so forth. And he said, give me his number, Kirsten, I'll call him. And this is the person he was. He called my father. He also called his oncologist, and they developed sort of a treatment plan to try to help improve the quality of his life until he passed in 2005. Now, at that time, there really was not a whole lot we could do. We have more tools in our toolkit now. But Dr. Silverman, I want to give a shout out to him up there for helping us. The Oral Medicine Clinic now, of course, has been named the Saul Silverman Oral Medicine Clinic. And if you're in a rural area and you need help with your oral medicine and oral mucositis, give them a call. I'm going to show you a quick video. This is Annette Quinn. She's a nurse educator. She's really a leading expert on oral mucositis, and she's going to talk about the ravages of oral mucositis. And I want to remind you all, if you do have any questions, be sure to type them for me in the chat area. Now, there may be a few of you, you're unable to hear the presentation on your device. And if that's the case, you have the link in the handout.
One of the most debilitating side effects reported by patients from cancer therapy is oral mucositis. And what oral mucositis, or OM, is it's an inflammation of the lining of the oral cavity, which leads to ulceration. Altered nutritional status is another issue that we see in these patients. They can't eat, they can't drink, and of course, extreme pain. You get a bone marrow transplant with high-dose chemotherapy, you're at 100% risk for developing oral mucositis. Approximately 500,000 cases of oral mucositis occur in the U.S. per year. In 2009, Medicare reimbursed over $40,000 per patient for ulcerative mucositis lesions.
We're going to see and hopefully understand that oral mucositis is devastating. It can prolong treatment, delay treatment of our patients that are undergoing cancer treatment, and also worsen their prognosis if they're not able to complete treatment. Let's talk about the prevalence here. 30 to 40% of cancer patients treated with chemotherapy go on to develop mucositis, and 60 to 85% of those undergoing chemotherapy along with hematopoietic stem cell transplant. 90% of those for head and neck cancer patients treated with radiation plus chemotherapy. The problem here is that patients that are affected by high-grade mucositis have to reduce their chemotherapy regimen. And again, that can delay cancer treatment and worsen the prognosis. Oral mucositis has a multifactorial etiology. It can be caused by direct toxicity from the chemotherapeutic agents. It's an inflammatory response, microbial factors, immunosuppression, and patient-specific factors. When we talk about direct toxicity, we're talking about the chemotherapeutic drugs and radiation therapy that can target these rapidly dividing cells and include also the cells lining the oral mucosa. And it's not just the oral mucosa, although we're focused on the oral mucositis this evening. It's really all of the mucosa, because the human body is oral mucosa, or is a mucosal tube, right? So it can also include the gastric mucosa as well. And this is a direct cytotoxic effect, and it leads to damage and, of course, ulceration of the oral mucosa. And that damage that's caused by chemotherapy and radiation therapy can trigger an inflammatory response, as we'll see. And that inflammatory cascade can exacerbate the tissue injury and contribute to OM development. Microbial factors here, the oral mucosa is a barrier, right? So when there's some sort of ulceration or disruption in that barrier, it permits the pathogens, the opportunistic pathogens, to proliferate, and that can lead to secondary infection and, of course, worsening of further mucositis. Now, immunosuppression as well, cancer treatments can suppress the immune system, and it can inhibit the repair and regeneration of damaged tissues. And we also have patient-specific factors that can influence the severity and susceptibility of oral mucosa or oral mucositis, age, nutritional status, pre-existing oral health conditions, and genetic predispositions. We know that the exact mechanisms are better understood now than they were even back in 2005 when my dad was going through his treatment, but they're still not well understood. We know that epithelial damage, inflammatory response, microbial colonization, infection, oxidative stress, impaired wound healing, and neurological dysfunction are all at play. When we talk about epithelial damage, we're talking about, of course, the damage to the oral mucosa directly, as we said, from chemotherapy and radiation therapy, the disruption in the mucosal integrity leading to erosion, ulceration, and then the overall breakdown of the oral mucosa. When we talk about the inflammatory response, we're talking about, again, the inflammatory cascade. And this is a release of pro-inflammatory cytokines. And that release, as we know, is involved in inflammation. And in this case, it amplifies the inflammatory response that increases tissue damage. And again, for those of you that have just joined us, and I see quite a few of you, be sure to download the handout and CE credit instructions by tapping on that red banner at the top of the screen and reviewing the instructions we have in the chat area for you. Deborah is here, who's a friend of our program, and she said she is a head and neck survivor. The radiation treatment results are forever. Yes. So microbial colonization and infection, we said when the oral mucosa, which is a barrier, is disrupted, it can permit these pathogens to invade, and that overgrowth can delay healing, leading to further tissue damage from OM. Oxidative stress, cancer treatment, chemotherapy, radiation therapy generates reactive oxygen species, ROS, and free radicals. And in that case, ROS-mediated oxidative injury contributes to the epithelial breakdown. And that leads to mucosal inflammation and DNA damage and cell death, which we call apoptosis. And that impaired wound healing leading to epithelial damage, inflammation, oxidative stress, all disrupts normal wound healing, impairs proliferation and migration of epithelial cells, decreased production of extracellular matrix components, leading to more delayed tissue repair and regeneration. One thing to note about oral mucosa is the level of pain that the patients experience. It's quite profound, and it's not just the inability to maybe nourish oneself, but actual pain from peripheral and sensory nerves. And in cancer treatment, it can affect the peripheral and sensory nerve endings in the oral mucosa. So these patients experience neuropathic pain, altered taste, and dysphagia, which is a difficulty in swallowing. And that neurological discomfort or dysfunction, further exacerbates the discomfort and the functional impairment. So risk factors for oral mucositis. And again, any questions or comments? I'm sure most of you have been touched by cancer in some form, either self or family members, and understand oral mucositis. It's different when you're treating patients in an oral medicine clinic from your family members, though, and you're living it day to day, and you're seeing the patients basically starving to death because they're not able to nourish themselves. And it really becomes a prominent factor in their lack of survival, right? It's the effects of the treatment. All right, so let's talk about risk factors here. Risk factors, of course, cancer treatment being one of them. Intensity and duration of the treatment, the type of cancer, pre-existing oral health conditions, nutritional status, smoking and alcohol consumption, age and general health, and genetic factors. Comment from Haley here. Her husband just went through BMT and OM. It was so sad to watch. Thankfully, he's 50 days out and doing so much better. That's terrific to hear. So when we talk about risk factors and we understand the effect of chemotherapy and radiation therapy as contributors to OM, certain chemotherapeutic drugs, particularly those with high mucosal toxicity and radiation therapy involving the head and neck region, increase the likelihood of developing mucositis. So in the case where the treatment is located, makes great sense in terms of the increased risk for oral mucositis. So for intensity and duration of treatment, higher doses of chemotherapy or radiation, prolonged treatment durations, and an elevated risk of developing oral mucositis. Now, this is a double-edged sword because the patient may have to reduce the level of treatment because they're unable to eat. So it becomes a balancing act here. They're admitted for enteral feedings until their nutritional status can improve, and then they're back at the high-dose chemotherapy. And again, they are bounced back and forth between the two. And of course, the lack of nutritional status and the inability to nourish oneself also contributes to the poor prognosis. Comment here from Rachel. She's 38-year-old dental hygienist, just recently went through 3 different chemo meds in her regime, one specific chemo med called the Red Devil. I can't imagine. And she said they would always have me hold ice in my mouth. We'll talk about that during administration, as they said that lowered the risk for any sort of mouth tissue sores. Thought that was interesting. Rachel, did that help? That's called cryotherapy. I'm just interested in knowing. So Haley agrees, yeah, it's a hard time even talking. He had a hard time. They missed his window for a feeding tube because it got so bad so fast. It was a battle for sure. Rachel had breast cancer. Husband also used ice as well. So that's called cryotherapy. We'll talk about that. So again, the type of cancer, the proximity of the treatment area to the oral cavity. So it makes sense that head and neck cancers have a higher prevalence. You might see that on a quiz. Head and neck cancers, again, along with hematologic malignancies and the aggressive nature of the disease requiring intensive treatment. So in the case of my father, he was diagnosed with small cell carcinoma, and I think he was gone within 5 months. That's how quickly it went. So of course, The chemotherapy was quite aggressive. He was not a large man by any means. And it was really a battle trying to get nourishment in. And he lived with a can of Boost or Ensure next to his chair 24/7, but he just couldn't swallow it. The oral mucositis was so severe that it was into the pharyngeal area. So he couldn't swallow really anything. Pre-existing oral health conditions, also a risk: poor oral hygiene, dental infections, periodontal disease, and mucosal trauma, all pre-existing. So there are thoughts around patients also that may have, old deteriorating amalgams and so forth, because that can interfere with some of the treatments that can be applied as well. So again, good, how would you put, promotion for why oral health is needed. We don't wish cancer on anybody, but of course we talk about the prevention and the oral systemic link here. And here's one other reason and one other correlation that oral health is important. So nutritional status, again, that's a double-edged sword, because if the patient enters their cancer treatment already poorly nourished, that is going to impact their prognosis. But again, because we have this condition called OM, that can also negatively impact their dietary intake, right? So poor absorption, we said oral mucositis may not just be oral, it can affect the epithelium along the mucosa as well, affecting the gastric tissues as well. Ryan said, Boost has a lot of sugar. I recommend my patients buy protein powder to get more calories and better calories. I'll tell you, Ryan, I used to think that too until I lost 35 pounds from C. diff, and I had to add calories pretty quickly. And I tried some of the protein drinks that had additional polyols in them and stevia, and I couldn't tolerate those with a gastroenteritis or colitis. So I did go back to Boost, and I was adamantly opposed to Boost. But you know what? I gained the weight. I felt great. I had energy. So sometimes I think it depends on the individual. But we have to be careful with some of those other protein shakes, because your patients that are affected, the mucosa, especially the gastric mucosa, they may develop a colitis, or they're not able to absorb some of these nutrients. The polyols that are contained in some of these protein drinks are an issue, because you have almost an IBS. And if anybody out there has IBS, you can't have those sort of polyols. Xylitol, erythritol, so forth are going to mess with you. All right, nutritional status, malnutrition. Again, we said inadequate dietary intake, poor absorption. Smoking and alcohol intake exacerbates the oral mucosa, irritation, inflammation, and compromises healing. And you will have cancer patients that continue to smoke. Unfortunately, my father had been a smoker, but he quit smoking when he was 51, when he had a massive heart attack. But he developed lung cancer about 14, 15 years later, which unfortunately is more common than we'd like to think, right? And so maybe that had some contribution, although he had quit smoking. But it does compromise healing, just like any other condition we're concerned about. Post-operative conditions, smoking will inhibit healing. Age and immunocompromised patients, so another risk factor. Older adults, many have compromised immune systems, or the immune system's like a battery. When we age, it doesn't fire like it did when we were in our 20s. And of course, underlying medical conditions, decreased tissue repair capacity, and increased susceptibility to infection. So certainly our patients that are immunocompromised already are going to be challenged here, right? And they're not going to respond to the agents like we would hope, and that increases their probability of OM. Genetics, can also alter response to cancer treatment. And certainly there's much more genetic testing now that's in play in terms of treatment of many cancers, but it may also increase susceptibility to OM. Any other questions or comments along the way? I appreciate all those comments. Keep them coming in. For those of you that joined us a little late, and there are quite a few of you, be sure you have the handout by tapping on the banner at the top of the screen, or review those instructions in the chat area. We'll repost those. Okay, clinical presentations. How many of you right now have patients in your clinic or your practice that are going through cancer treatment of some sort, experiencing oral mucositis? I'd be interested in knowing what your treatment regimen is or what your practice regimen is. Are you working with oncology or oral medicine as well? One patient, but not OM. That's good. Collaborating with all physicians. We used to use Benadryl, Maalox, and lidocaine, yes, to alleviate the pain and try to improve comfort. We're getting there. At UC, we called that the UC cocktail. So it was Benadryl, milk of magnesia, sometimes a steroid, right, and lidocaine. The magic rinse is the other name for it. Magic mouthwash, surgical practice. Okay. Clinical presentations here. Oral pain, mucosal erythema, redness, swelling, ulceration, erosions, difficulty eating and swallowing, altered taste, salivary changes, oral infection, and functional impairment. Question, can dementia have related to OM? Well, dementia can certainly have relationship to chemotherapy. So you've heard of chemo brain. Really high doses can affect cognition. Yeah. We're going to talk about laser as well. The magic swizzle. I like that. Okay, so oral infections, functional impairment. Oral pain is the hallmark symptom. Mild discomfort ranging up to severe. Can be a burning, stinging sensation, may worsen with eating, drinking, and speaking. Ulcerations and erosions. With progression of oral mucosa, the patient may develop these ulcers, erosions, epithelium may become denuded, very painful, and also increases the risk of secondary infection, as we said, because the mucosa is a barrier. Difficulty eating and swallowing leading to reduced oral intake, nutritional deficiencies, weight loss, all equal to enteral feeding, tube feeding, due to pain, ulceration, dysphagia, and odynophagia, painful swallowing. Jenna said her patient just went through chemo and radiation, used an oral rinse, did not get our OM, not sure if it's related. Insurance companies won't pay for it due to most of the ingredients being over the counter. Can it be misdiagnosed? There's some overlap with other conditions, but if the patient's being treated with chemotherapy and they're cancer patients, that's pretty diagnostic. But there certainly can be other overlaps if the patient, depending on what the patient had on board, before they were diagnosed. Let's say they had an autoimmune disease, right? So there are some conditions that can mimic oral mucositis, but the fact if they're being treated, that's fairly diagnostic. And the oncologist would be involved in that diagnosis too. Hepatitis also. Yeah, that Kelly said she was 29 and had hyperemesis from pregnancy and was on a feeding tube. It is pretty awful. All right, so altered taste sensation, less food intake. If you have a change in taste perception, or if something tastes different than it should, like metallic or bitter, you develop a loss of taste, that can impact also your appetite, right? And that's something that I've noticed in my patients. And it was actually something I experienced since having C. difficile, because I have kind of lost my sense of food cravings. I don't get hungry. So I have to set my clock to remind myself to eat. And the food doesn't taste the same. And then when I got COVID, it sort of gave me a sense of that, because everything tasted like burned plastic for a couple of days, right? So it gave me the sense of what it must be like to experience something like that and loss of taste. But now I have no real cravings for food. I don't get hungry. I have no appetite. It's not that I'm satiated, it's just the sense of it has gone. And that, I believe, is probably what happens a lot with these patients as well. Cheryl said that she had such bad esophageal erosion when she had chemo that they had her actually drinking the magic mouthwash. Yes, rather than rinsing. She had about a half a liter every 2 days. The pain was unreal because she also developed a GERD at the same time. Thank you, Cheryl, for letting us know. So it is bad. I mean, and I know the magic mouth rinse, we did have the patients swallow it. As I remember, they had to swish and swallow. And again, I had steroids, diphenhydramine, Pepto-Bismol was one, or the other, milk of magnesia. And that was the only thing we really had back when I was in my oral medicine rotation. Had to drink it in order to be able to swallow, right, because of the lidocaine. Deborah said she developed GERD as well. And again, reminder that the mucositis doesn't just affect the oral cavity, it can affect the entire mucosa. So esophageal all the way down to the anus. Lisa, I don't know about that particular brand. So, and pH neutralization is not necessarily part of the treatment for oral mucositis. We're going to talk about that in just a minute here. Salivary changes can occur. Xerostomia. So in xerostomia, you can have salivary gland hypofunction where you're not producing enough saliva, which happens in our patients, or can, or a change in saliva composition, right? So the composition of the saliva might be thick, stringy, ropey, viscous. In this case, many patients with OM will describe sticky, thick saliva and dry mouth. So it's a xerostomia issue. So Haley said her husband had oral mucositis the entire length of the mucosa, from the mouth to the butt. Magic mouthwash didn't touch it. Was surprised that they didn't have any other options or recommendations to help other than heavy pain drugs, which is something we're going to talk about here, because opioids are often used as treatment. And the video that I showed you with Annette Quinlan earlier, she was there speaking to Congress about opioid addiction, basically, and oral mucositis. We are going to touch on PBM laser therapy. Yes. Can ozone therapy help? That I don't have data on. But if you find an Anatolian, you send it to me, I'll include it in the presentation. Okay, so oral infections are a real issue. As we said, the oral mucosa is a barrier. It's supposed to be there. It's supposed to be intact. So when we disrupt that barrier and we have pathogens and other microbes that live in the oral cavity, and many of them are supposed to be there, that opens a wound and you can develop secondary infection, characterized by increased pain, swelling, white patches, or lesions. Functional impairment can significantly impair the quality of life, difficulty speaking, mucosal bleeding, decreased ability to maintain oral hygiene. So evidence-based prevention and management strategies. So some of you have been talking about PBM. We've got Dr. Cutler here, who is with the Academy of Laser Dentistry. So I'm really on trial right now. He's an expert on PBM, as well as Dr. Grace Sun, who presents on our platform from now and then. Evidence-based prevention and management strategies. Oral care protocols, emifostine, cryotherapy, palifermin, and LLT, photobiomodulation, also known as cold laser or PBM. So oral care protocols require a comprehensive approach prior to, during, and after cancer treatment. So we're hearing from folks here who have had loved ones that have gone through cancer treatment, or they themselves have gone through cancer treatment, and you can hear the protocols are all over the map. Some have had the magic mouthwash, some have not. Some have had to suffer through it and they survived it. Some did not. Some developed GERD, some did not. So it requires really a team approach. And again, when I reached out to Dr. Silverman, he developed a treatment plan, but it was really the best we could do back in 2004, 2005. We didn't have that many tools in our toolkit. Tonight, I'm happy to say there are more. And if you stay after this presentation, you're going to hear from ioTech, and they're excited that they'll be launching a product down the line here that will be used for the treatment of oral mucositis. So again, comprehensive approach is required. Regular oral hygiene, brushing, flossing, oral rinses. So hopefully those of you that have patients on your service, in your practice, that have cancer, you have reached out and introduced yourself to their oncology and oncologist, their nurse practitioners. So you're working together as a team to help your patient. And it is interesting. So Michael said, amazing how many people receive cancer treatment and the oncologist does not make sure they are being seen by their dentist. Question about the magic mouthwash. So the magic mouthwash is a cocktail. Compounding pharmacist made it back when we used it at UC, and it contains diphenhydramine, Benadryl, milk of magnesia, lidocaine, in some cases steroids, and the patient swishes it, and in some cases we had them swallow with it. How long does OM last? Well, it depends. Sometimes it'll last for the duration of the cancer until the patient may not survive or their treatment ends, right? So it depends on the patient and the treatment. One person here, Haley, said that the oncologist advised them not to brush at certain points. So again, there's a real disconnect sometimes between what we're doing and what medicine's doing. All right, so emifostine is called a cytoprotective agent, and it has shown some promise in reducing the incidence and severity of oral mucositis, particularly in head and neck cancers. And you may see that on a quiz. Double check that question when you answer it. Scavenges free radicals, protects healthy tissue from radiation-induced damage. And there's the link to the Cleveland Clinic if you want to know more. Yep, compounding pharmacy is where you would get the magic rinse. Amifostine is by injection, yes. Marion said that her oncologist told her to have a prophy before the chemo a few weeks prior to treatment, and that was over 20 years ago. Cryotherapy, we had somebody talking about ice chips. Ice chips are often recommended, also called cold therapy, shown to reduce the severity of oral mucositis in chemotherapy patients. Why? Because it constricts blood flow. So it potentially limits the cytotoxic effects of chemotherapy on the oral tissues. Cheryl said you can get the magic rinse now at some of your pharmacies. I know for some of them though, it's by prescription depending on what's in it. So you're probably not going to get the magic rinse with steroids on the over the counter. Okay, palifermin is a recombinant growth factor. Demonstrated efficacy in reducing the incidence and severity of oral mucositis in high-dose chemo patients and hematopoietic stem cell transplantation. Promotes the proliferation and differentiation of epithelial cells and enhances mucosal repair regeneration. Low-level laser therapy, cold laser photobiomodulation known as PM. And if you're not familiar with low-level laser therapy, you should be familiar with it because it has so many applications beyond just the prevention and in many cases, management, and in many cases, the potential prevention of oral mucositis in your cancer patients. Can help you reduce the incidence of dry sockets, for instance. It can help heal much quickly your various oral lesions, aphthous ulcers, for instance, herpetic lesions, lichen planus, and more. It can also be used for oral muscular dysfunction, TMD. It can be used as a preconditioner for local anesthetic. So if you want to know more about low-level laser therapy, go to the Academy of Laser Dentistry, which is laserdentistry.org, and find out about it. There's standard certification program. They're also now offering a course to teach you on the technology. And there are devices now that your patients can take home. They are LED devices, they're not laser, and they're handheld devices so that patient can self-treat at home. Ruth said she did the class with Dr. Namath. Great. So what it is you're applying low intensity laser, or in the case LED wavelength, to the oral tissues. And some of these are like flashlights that are handheld. And this can treat the inflammation. It improves the healing properties, mitigates tissue damage, promotes wound healing, and demonstrated in some cases to be preventive. And Annette Quinlan here, who I'm sure Dr. Cutler knows, has really gone on the tour about talking about the use of photobiomodulation to help prevent and or manage oral mucositis. It's one of the few toolkits we have in our armamentarium. And it's used as first line in other countries for oral mucositis. Europe, Brazil, the US hasn't quite caught on. So for you dentists out there that would like to reduce the incidence of dry socket postoperatively, especially in your smoking patients, improve the quality of your life for patients that may have lichen planus, certainly oral mucositis, definitely go to laserdentistry.org and find out more. All right, management strategies here. Topical analgesics, oral rinses and gels, systemic analgesics, nutritional support, mucosal protectants, antimicrobial therapy, and patient education. So topical analgesics, excuse the typo there, viscous lidocaines. Viscous lidocaine is something that is in some of the Magic Mouth rinse. I'm not sure about the consistency of the over-the-counter, but it's something that we used and we worked with compounding pharmacies. Mouth rinses that contain diphenhydramine, Benadryl, and then oral mucosa coating agents. So that was the reason for the milk of magnesia, for instance. But we're going to learn from ioTech here shortly about their product that's designed and has been studied in the case of oral mucositis. Systemic analgesics, NSAIDs, in some cases, unfortunately, opioids. The pain is that severe, and these patients end up on opioids, which is tragic, right? So hopefully we'll have something in our toolkit that you're able to offer your patients. Nutritional support. Adequate nutrition is essential, and it's a double-edged sword. If your patient can't swallow, they're not going to be adequately nourished, and they end up in the hospital with tube feedings, enteral feeding. Hydration, also essential. Counseling, dietary modifications, and nutritional supplements. And I know that we had a comment about Boost, and Boost, on any given day, I would never touch Boost. But I've seen patients that have used it, and yes, it has glucose in it. But the situation here is that it gets so severe that some of your patients can't tolerate some of these other protein drinks. So the oncologist hopefully is working with a dietitian to develop a plan for the patient. But honestly, with really severe OM, it doesn't matter. They're going to have difficulty swallowing anything. And we just heard from a couple of attendees that had GERD, which makes it really difficult to swallow as well. Mucosal protectants. So these are dressings that help to serve as a protective barrier when the mucosa is an open wound, right? So it's a topical dressing. Hydrogel is an example. Antimicrobial therapy. So in some cases, your patients may develop a secondary infection, as we said. And in that case, they may be prescribed antibiotics, antifungals. They may have a candida infection. I know my father had a candida infection. When I looked in his oral cavity, it looked like a cobweb, right? That's what I remember seeing with somebody who mentioned Dr. Silverman back in the days of the AIDS epidemic, which is when I was at UCSF. Those were the AIDS patients that I used to see as well. So antimicrobials may be required. Patient education, oral hygiene, symptom management, regular follow-up care. And again, I think making sure that we have a relationship with their other providers. Some recipes, yes, I forgot about that. Magic Mouth rinse. Some also include nystatin. So if you are concerned about oral candida, nystatin may be included in that mouth rinse, although there are fundamentally some dentists out there that are totally against nystatin because there is sucrose in it. But when you get to this point where you're not able to eat, you have to look at benefits versus risks, right? And in this case, having a patient use nystatin for 7 days, especially if they develop xerostomia during the process, is okay. That is okay. It's risk versus benefits. So some of the antifungals, Alice, nystatin is one. They may be put on diflucan as well, which is systemic. Hydrogel can be administered as a rinse. How long does it last and how effective is it? It depends on the patient, Dr. Strasburger. Okay, depends on how severe the oral mucositis is. And how effective is it? If we're talking about effective, what are we trying to achieve? Hopefully the patient's able to improve their quality of life. So if it's able to do that and they're able to eat and they're able to swallow, that would be ideal, right? Okay, so I'm sharing this information with you, and I hope you'll stay a few minutes afterwards to hear from ioTech. But this is the role of iodine in the prevention and treatment of oral mucositis. And numerous studies have shown that povidone iodine, which many of you may be familiar with, is effective in mitigating and resolving oral mucositis. It has a potent antimicrobial, anti-inflammatory, anti-edema, and immunomodulating properties. And we just reviewed this in some detail, right? Inflammation cascade effect, immunomodulating issues, erythema, swelling, and then, of course, secondary infections. So iodine has been shown and demonstrated in studies to improve that. The ability of iodine to control oral mucositis is directly dependent on the ability of iodine to be absorbed in the oral mucosa to provide a substantive effect. So substantive effect is important. Molecular iodine, I2, is the principal bioactive species of iodine. It is the only species of iodine to be readily absorbed into the skin or the mucosa. Molecular iodine, I2. I2 is present in povidone iodine at a level of only 2 to 3 parts per million. It's present, however, in iorinse and iorinse MR, which is going to be the product that ioTech speaks to you all about here momentarily, at 100 parts per million. Increased I2 levels mean increased effectiveness against oral mucositis. And there are some links there for you below. There are my citations for you. Let's go ahead and see what questions you have. Alice, I can't answer that question for you, but if you want to stay on and ask the ioTech team about that, if you have a moment, you're welcome to, or you can reach out to them at iotechinternational.com. Any other questions or comments? Thanks, Kelly. Crystal, if you reach out to us, we'll also be sending the slide deck afterwards. Yep, we won't leave you hanging. Thank you, everyone. So if you have any questions, feel free to reach out to me through the website. If there's a question that I wasn't able to answer for you, I will definitely find out. There's a question here about curcumin to help decrease some of the inflammatory response. I don't have data on that, but I'm happy to look it up. I'm always interested in knowing and learning from you all. So I will definitely look that up, Dr. McKernan, and find out for you. Any other questions or comments? And for those of you that joined us a little late, be sure you have the handout. After chemotherapy, does the oral mucosa heal up with the usual timing? I don't know what you would call the usual timing. Usually after chemotherapy, again, it depends on the patient and their constitutional factors as well. What else do they have going on, right? So physically and how well nourished are they able? So the mucositis may not just be affecting the oral mucosa. Again, if it's affecting the gastric mucosa, they may have an absorption issue for some time. So their diet might be altered, etc. So it's a little bit more complex than that. So I'm not sure the usual timing, but for some it can take, a few months to a year or so. Okay, well, I am going to bring up information, and I thank you all for being here, and I'm going to go through some of these. If you, again, have any questions. Chamomile tea mouthwashes, are they useful? I don't have that answer. I'm presenting to you all, I have to present the science. So if I present something, there has to be evidence-based material behind it, peer-reviewed citations, and so forth. I'm not opposed to experimenting. But when I give you information, I want to make sure that I have the background, that it makes sense scientifically as well. But I know anecdotally, chamomile tea works very well for gastric issues and mucosal issues. Give it to babies for colic, right, etc. I certainly drank a ton of chamomile tea with C. diff. But was it useful? Is it useful? And how do we describe useful? Does it reduce the symptoms? Is it going to permit somebody to be able to eat with oral mucositis? That has yet to be seen. So I don't have that answer for you, but it's a good question. I am going to go ahead now, Jason. I'm going to bring up your presentation, and we are going to change a link here at the top. So those of you who don't have the handout, make sure that you have it right now by tapping on that link. I'm going to be changing it here in 1 second, and I'm going to introduce to you one of my favorite people. And the link is changing right now, and we're going to send you off now to ioTech World. So for anybody who would like to know more about products that you can use for your patients, oral mucositis, periodontal, pre-procedural rinses, and so forth, please stay on. Not required for CE credit, and we'll go ahead and start here. So Jason, welcome. Thank you for being here this evening. And you are mute.
Thank you very much. Kirsten, thank you very much for having me again tonight. I'm very grateful to be here. And once again, your presentation is spot on. And I think that what you do for the community, like I always say every time, is wonderful, because in this dental community, we're always learning. And I think there's a lot to be there's so much more learning to do. And even as a presenter or a speaker, as soon as you're done with this, you're continuously trying to figure things out yourself, and you're still never done learning. So tonight, I want to welcome you all for coming here tonight, all of you 700, 600 people here tonight. This is so important for you guys to pay really close attention. My name is Jason Gerasimovich. I'm the Global Sales Director for ioTech International. It was founded back in 2000, actually started back in 2013. We were a molecular iodine research and development company. The idea was what if we could take the iodine technology and what if we could take povidone iodine, the active that's in povidone iodine, which is called molecular iodine, which is found in a very small trace in povidone iodine. What if we can increase the levels of it, make it higher levels of it, and at the same time, all the other iodine that's in povidone iodine, let's lower them down and let's move them out, because they're toxic. To continue sustaining, they really don't do anything to kill germs. It was actually the only thing to kill germs was molecular iodine, and without, that's actually I2. And so the idea of taking that molecular iodine and increasing it in very high levels and getting rid of the other iodine that didn't need to be there, what we did was we made the strongest antiseptic in the world, but yet something so deadly to germs, but yet so safe to put in your mouth, and so safe that people actually can drink it, and dogs can drink it. But we don't drink it. We spit it out because we know how to. We're going to get into that. See if I can pull up my slideshow. Is there a way I can pull that up here, Kirsten? Excellent. Okay. So when we're looking at the bottle on the left over here, that's povidone iodine. You guys all know povidone iodine, which is used in hospitals as a surgical scrub. Surgeons scrub with it. And if you look at that blue ball in that red bottle there, that little blue ball is called molecular iodine. That's what's responsible for killing all the germs. And the rest of that in the red are all the other different iodines that are in povidone iodine, and they contribute to thyroid toxicity and other problems, and as well as they really do not do anything to help kill germs. So the idea was on the bottle on the right was, if you look at the molecular iodine, a complete bottle of molecular iodine, and just very little small traces of anything else that's barely anything there. And what we did is we took that 3 parts per million of molecular iodine, which is in povidone iodine, and in this bottle on the right, we've increased it up to 300 parts per million. So the bottle on the right is 100 times stronger than the gold standard of care in hospitals throughout the world, yet safe enough to put it in your mouth. And that's the magic. And that's magic. And why is it magic? Is because when you look at this chart, you're going to look at molecular iodine on the top, and this is tested in fresh, whole human saliva. And you will see that the molecular iodine at 100 parts per million of iodine, at 100 parts per million, kills all the germs that cause periodontal disease. And the two that you see here, Fusobacteria nucleatum and Prevotella, we completely inactivate it within 30 seconds. And every other mouth rinse that dental offices generally use falls way short. It's not that they fall way short, they're actually way more toxic. And why would you want to use anything way more toxic? I didn't know if you guys know this as well, that the molecular iodine acts as an anti-inflammatory. It is wonderful for helping the swelling, and it's actually amazing what it actually does. Now, this is a test of a product called iRinse Ultra, which is an over-the-counter drug. Now, what's interesting about this is that this is 100 parts per million of molecular iodine. It also has xylitol in it, glycerin in it, and so when you look at this bottle here, by the way, it's an FDA OTC over-the-counter drug. That bottle there is what you see that it was tested right here, and that's what it was tested in. And by the way, Pulphomonas, gingivalis, and Tenorella forsythia, you can see in 30 seconds was also tested, and we were able to wipe them out. Chlorhexidine is a class 1A carcinogen. It is class 1A means it was studied with humans, and also you'll also notice that with chlorhexidine, it's stained. It can't be used long term, and it's really not great for implants. Actually, it's actually horrible for implants. And when we talk about using chlorhexidine, or whether you're using molecular iodine, the idea of using the molecular iodine is wonderful for tissue. And the reason I bring that up, why am I even talking about it? This was a gentleman using chlorhexidine who went to a dental office and texted me this photo of his tongue afterwards, and just showing me that the hygienist said that the cleaning, they said this is normal. One of the things about the iodine is what happened with us was when we had first started, we were using our rinses as a pre-procedure rinse in dental offices. Then we moved because we knew that the molecular iodine was going to be so great for periodontal disease. And when we did our studies in fresh whole human saliva, and we were able to show that we could remove those bacteria that cause perio to begin with. But then when we talk about periimplantitis, and how horrible it is that all these patients that are spending so much money to get implants, and then they have to have their get periimplantitis, and then before you know it, the implant fails, and then they have to go with dentures. And meanwhile, they spent all that money. And the idea of rinsing morning and night, what it could do in the mouth is unbelievable for the bleeding gums, what it does for the bacteria in the mouth. It's so great, and it's so safe. It is not a carcinogen. It actually, material safety data sheet is a clean, 100% clean slate. It is wonderful. And by the way, anytime you put a product in your mouth, make sure you look at the material safety data sheet, and you'll be blown away. Now let's talk about the why we brought up Iowans MR, which we brought to market now. Iowans MR is called Iowans Maximum Relief. What this is Iowans Ultra, basically, with a couple more percent, 2.5% more glycerin. And because we added glycerin, it then becomes a FDA approved product, which is coming out in a couple of months. And we already have some bottles available. And I'll get talking to you about that as well. But this is unbelievable because when you take the molecular iodine at 100 parts per million and you're rinsing with that gets right to the sore and the tissue, and it helps for inflammation. It is unbelievable what it does for swelling. And then on top of it, there's no alcohol in it, so there's no burning. And the glycerin is great for the dry mouth, and dry mouth is part of the whole thing with cancer. Unfortunately, I'm 4 years too late. My mother passed away 4 years ago. She was a smoker herself, developed lung cancer once. They removed the lung, made it a few more years, and she didn't make it the second time. But I can tell you that her mouth in general, it wasn't pleasant at the end. Like Kirsten had mentioned, it is horrible to watch a family member go through what they go through. Forget about just getting cancer. That's already a problem enough. But having to deal with the symptoms from the cancer is unbelievable, and symptoms from the chemotherapy and the radiation. Now, we've dealt with so many cancer patients where we sent them a free bottle of Iowans MR because we wanted to know, will it work or will it not, and is it effective, and did it help you? And every single one of those people said that it dramatically helped them with their cancer in their mouth. So we tested this with people, real live cancer patients. And what's so awesome about this is not only is the dental community picking this up because it's helping with bleeding gums, and it's helping with canker sores and patients with ulcers in their mouth, and so many different things. And don't take it from me. Go to Amazon, type in iorinse, and I want you to look up mouth sores because that's one of the links, and read all the reviews about the mouth sores. We didn't make it for mouth sores. We didn't originally make it for that. But when we saw the dramatic effects and we saw this, we knew it was time to make Iowans MR. And we knew it. And we knew it so well that the glycerin was going to be helpful, that the xylitol was going to be helpful, and the molecular iodine was going to be helpful, and the glycerin and the and the zinc. And I'm telling you, it is a wonderful rinse. This is our award-winning products, as you can see. On the far left, you got Iowans Ultra, over-the-counter drug. It's now available in dental offices. Dental offices buy these bottles for around $14 a bottle, and they're able to sell it to their patients for $40 a bottle. The idea of a patient going home with bleeding gums and swollen gums is giving them a chance to go home with something that's going to be effective and safe at the same time, and also give them a treatment rather than something that can only be used for 2 weeks. This is a product that can be used daily, every single day, and should be used daily. Iodine is an essential nutrient. You need it. There was 1,000 women who ingested a 6 milligram tablet, which is actually drinking 6 ounces of this iodine, 100 parts per million of iodine daily. And they did that for 6 months, and it was an FDA study, and the blood tests were done every day. And there was no adverse reactions. Okay. So when you got to the next bottle of Iowans MR, which is coming out very soon, we do have some pre-launch bottles that we're going to talk about. Iowans Soft Mint, which is one of our top-selling products. It's Iowans Soft Mint, ready to use. This is a wonderful product. This has xylitol, molecular iodine, glycerin. Now, what is the difference between the product that we have out now and the Iowans maximum relief. And if you look, they're both the same thing. The only difference is this has a little bit more glycerin on it. And by adding more glycerin, helps the mouth for the dry mouth. But it still does wonderful for the sores in the mouth. And this is the same rinse that they will be using as iorinse MR. And this is what they will be using. This is what cancer patients have already reached out to my uncle, Dr. Herb Moskowitz, and said to him that this is the most amazing thing they've ever had. And they've been using, there's a lady in our office who has had it. And again, she used this during the whole time and didn't suffer. It's an amazing product. What this iodine at 100 parts per million and even more is doing for cancer patients is going to be so helpful because it's safe, it's effective, it doesn't burn, it feels good, and it helps people get comfortable. If they can get comfortable, then they can fight and have a good fight and a fair fight. The next one is green apple. We have a green apple flavored. We also have a concentrate version that goes into a water pick. Patients can water floss with the iodine. It is wonderful for a patient to go home, put one capful into a water pick, fill it up to 300 ml, use it with a water pick, with a pick pocket, subgingival tip, low setting, mid setting, and the reason is because of the pressure that's in there. You don't want to burn that motor out. In the meantime, flossing daily with that is wonderful, but at the same time, subgingival irrigation, and this is also used for your scaling and root planning in your office. We have a hand cleanser. We have io gel, which is a tray gel, which was, there was just an email we got today from somebody that said it was dramatic for the patients. We also have ioVet Oil, a pet water additive for dogs and cats. Now, you got to remember that we're asking people to rinse their mouth out with something that dogs and cats actually drink. Now, again, they're not drinking at full strength. You're putting a little bit into the pet's drinking water, and it is actually a cat or dog nutritional level, and it's wonderful for the dog's gums, teeth, mouth, odor, and so much more. We have a nasal spray that we use, and we also have a nasal barrier cream as well. When you look at iorinse Ultra is again compared to when you look at your other products that you may be buying. This is a wonderful bargain. You get 12 bottles in a case. The average price is $14 a bottle, $14.60. Average sale to the patient is $41 a bottle. If you have several patients leaving every month and they're using this at home, they'll be coming back to get their next bottle from you. And it's a wonderful new profit center, and it also gives you the best patient care. We also have the smaller bottles, which are 16-ounce size bottles, and the 16-ounce bottle, just to show you the difference in size. This is the patient convenient size compared to the bigger bottle. Again, you get 24 bottles in a case, and they only run $9.46 a bottle. You sell for almost $30 a bottle, which is actually $27.85 is what it says here. Iorinse Soft Mint, again, xylitol, glycerin, molecular iodine. This is wonderful for all those things that we're talking about with canker sores. You could just read on the Amazon reviews, and it is on Amazon. By the way, when we sell our products on Amazon, we sell the products for $45 a bottle, and we sell it for $60 a bottle. We don't come down any lower than that. And the reason we do that is we want to protect the interest of our dentists, because our dentists, when they want to sell it, that's what they should be selling it for. So they don't want to be embarrassed and say they saw it for cheaper from somebody else. And so we don't embarrass our dental offices. We do have different flavors. We have green apple. Again, they come in smaller size bottles of roughly $9 a bottle. And again, $27-30 a bottle is the average sale price. Iorinse concentrate is used for the water pick, scaling and root planning, subgingival irrigation, and it is also used for water lines as well in the office. And again, adding this to a water pick, there's nothing better than water flossing with the iodine. By the way, it actually water flossing with actually there was a study that said brushing and rinsing is more effective than brushing and flossing. And again, my uncle, Dr. Herb Moskowitz, does a CE class, oral rinses, what's effective, what's not. And of course, that slide will be in there so that you guys can actually learn. Please take that class. Everybody that's here, all 430 of you at this point, there's a tap here button. I am giving out free samples. I want everybody here to get a free sample. So I am giving free samples. Please, again, that tap here button, fill the contact information. Please put your name and information in there, because we will be sending out free samples to everybody that does put their information in, and also information as well. IO gel is made for like a Perio Protect tray, makes the a wonderful tray. Denmat makes a wonderful tray. You could make a wonderful tray yourself with a soft EVA 3mm thick tray. But when you add the IO gel to the tray, what's really nice is IO gel is molecular iodine. When you actually take the class on oral rinses, what's effective and what's not, you'll learn about the hydrogen peroxide gel that they use in different gels. But our gel is actually the favored gel, because the iodine is compatible to the tissue in the mouth, and there's xylitol in here too. So it is wonderful as a perio gel, and it's actually wonderful for advanced perio. And patients with severe perio, they wear the tray for 5 minutes a day, no more than that. And it's a very simple way. They just put it in the tray, they bite into it, and the pressure goes right up into those pockets, and it sits there for a little while, 5 minutes, take it out, and 5 minutes wear time. Wonderful, great treatment. In the dental office, $20 a bottle, sells for nearly $60 a bottle. IO Mist is our nasal spray, saline mist spray with molecular iodine. We do not make any claims, but you can only imagine that povidone iodine has 3 parts per million. If this has 25 parts per million of molecular iodine, you can only put 2 plus 2 together equals 4. It's a wonderful product. IO Shield is a nasal barrier cream. It's actually wonderful. It's a molecular iodine cream. You can swab the inside of your nose, and we like to call it a nasal barrier. So it's you can learn about that as well. So IO Cleanse, our hand cleanser. Again, we don't make any claims for our products, but we do mention that the what is in it, and the amount of molecular iodine in this is so much more than what is used in povidone iodine. And if povidone iodine is the surgical scrub, and the active that's in povidone iodine is increased by hundreds of times, I would say that this is a wonderful hand cleanser. We're looking at IO Vet Oral. This is our pet water additive. This it actually is an amazing story. And actually, anybody, please hit the contact form, and it's the ioTech free samples. And when you hit that, you're going to put your name, phone number, email. I'm going to send you information on all of this, send you a free sample for everybody, and you're getting samples, and you're going to be blown away with this. And at the end, I got something better even coming along. ioVet Oil is our pet water additive. It is a wonderful pet water additive, because dogs and cats cannot clean their teeth, and they won't. And people don't even clean their own teeth. So what makes you think that dogs and cats are going to get any better treatment? But when you add a little bit of our molecular iodine to the pet's drinking water daily, it has been shown to be more effective than brushing by a veterinarian himself. So daily brushing is actually stronger, is actually weaker than using molecular iodine. And now, what I will tell you is that there was a 37.4 or 37.8% reduction in plaque in a month's time using with a veterinarian brushing the dog's teeth daily. Right, remember you got to hold the dog enough to do it. And then if you didn't do that and you just added one, few drops of this to the pet's drinking water, the iodine is actually 44% reduction in plaque. You can only imagine what it's doing in the patient's mouth. I guess that's why when iodine came out is known as the anti-plaque and anti-gingivitis. I tell you, when you know what this iodine does, it is truly amazing. And I've got some personal stories to tell you as well. Coming soon is the iorinse MR. Iorinse MR is going to be released in roughly 3 months from now. This rinse is unbelievable for oral mucositis, mouth sores, canker sores, oral ulcers, and dry mouth, xerostomia. So when you have a patient that sits in a chair and they're complaining of an ulcer or something in their mouth, don't let that patient go home in pain whatsoever. There is an answer now, and this is a wonderful answer without alcohol. And this is a wonderful daily rinse. And for those that do have oral mucositis, it's recommended to rinse more frequently during the day while they're going through treatment. But it is an extremely effective rinse. Canker sores. You'll read on Amazon about people who swear by this for canker sores. I do have a few big contacts of some very well-known dentists who have used this product in their dental office, and they've seen the most dramatic results that they now stock it for that reason for sores in the mouth as well. Oral ulcers. We do have a patient who has Crohn's disease. Crohn's disease does not affect just the stomach. Those sores come out all the way out to the mouth, and those ulcers are extremely painful. If you can imagine something so small and tiny could be so painful. And that's the idea is that when you look at them and when you see this and you read what it says oral pain, helps to relieve oral pain, canker sores, oral pain. That's what I care about. I don't want to be in pain, and nobody wants to be in pain. So iorinse for lichen planus. We've heard of people again where they've had great luck with that. Again, we don't make claims on this. It's just that when you use it, you'll figure it out, and you will figure it out. And but what we can make claims for are for the mouth sores, for relieving dry mouth, for relieving oral pain, and for relieving the oral ulcers that are in the mouth. Alcohol-free, and again, the molecular iodine, which is the inactive, is present at 33 times more than what they use in hospitals as a gold standard for an antimicrobial. It is so incredible what it does for inflammation. And that's what we're fighting, folks, is inflammation. Inflammation is what causes all that pain. And those bleeding gums that comes from all that bacteria that sits there all night long. So when a patient rinses at night before they go to bed, they got a fighting chance. They do not have a fighting chance with just brushing their teeth and flossing before they go to bed. This is the failed graft on the bottom, on the top actually, with the failed gingival graft. Periodontist did this, and really amazing, because when you look at the bottom, what the patient was going to have to come back, they had the patient come back to reschedule the appointment because they wanted to do another, they figured they might have to do a regraft. And what they have noticed that after a few weeks of using the iorinse, that the graft closed up. There's a little bit left, but it's closing up. It's healing. It's healing on its own. That's the effects of this. But when you see something like this, and you see a patient with sores on the tongue, and I know this is painful. It's got to be, and we ignore it because there's nothing we can do other than tell them to go try something, but you should be stocking it in your office. Why? Because that's what the patient's waiting there for. They're waiting to go home out of pain. And for $14 a bottle, 15 bucks a bottle, and you're selling it for 40, it's a wonderful profit center, and you're helping your patient out. And it's a big bottle. And look at this. In just a few days, just a couple of days. This isn't weeks, folks. You know, it's actually amazing how fast it works. For Cankersaurus, forget about it. People say they swear by it. It's gone in a day or two. I mean, the lesion's probably still there. Pain's gone. So it's about pain, folks. It truly is. My mother suffered. My mother said to me, because of the insurance, that she couldn't get the drugs that she needed, the medicine she needed. I wish this was around when she was alive, because then it would have made her feel that much better and just made it feel a little more comfortable. It's about being comfortable. It's about helping people be out of pain. Chlorhexidine is a class 1A carcinogen. It stings. It's horrible for implants. It's what people use in their offices all over the world today. I still don't understand why they would put that in someone's mouth knowing that this is out there. And that's why Dr. Moskowitz's class is so important for you to take. It's 1.5 credits, or inches, what's effective, what's not. Please hit the tap here button. And the reason why is I'm sending everybody a sample and information. And not only am I sending a sample, this is a home run, folks. Hit the tap here now button, because all these products that you see, the big bottles, I'm not talking about small bottles, I'm going to be giving everybody the big bottle. And I want everybody to try all of our products that we have, including the iRinse MR, the maximum relief, and that does have the 4.5% glycerin, the 100 parts per million of molecular iodine in there. And again, this is a sampler kit that we normally would sell for quite a bit of money. We're selling it for $80. And by the way, that includes shipping, by the way, folks. So, you know, we're not trying to hit you over the head, but this is a lot of weight right here. And to ship it, it's expensive to ship it. But we need to put this in your hands, because we are so confident that in your office that you guys are switching, and you're choosing to switch because you're looking for the best patient treatment outcome. And that's what we believe in. And that's why ioTech International is here today, because the products that we're coming out with for even ear infections, for skin, we've licensed our technology for advanced wound care. We've licensed our technology for agricultural use, because in agricultural use, it's safe for plants, it's safe for animals. And that's the beautiful part, is that why would you want to put something toxic in your body when you already got enough stuff that's toxic in your body already? How much more toxic stuff can we put into our bodies?
Jason, I want to remind everyone that the banner that you're talking about is at the top of the screen. So those of you looking to get the samples and take advantage of this promotional discount, there you go. Tap on that red banner at the top of the screen. We also have the link for you in the chat area, and you have some questions about the product. I think we're going to need Dr. Moskowitz to answer some of these clinical questions. I think I see them there.
Thank you very much. And I'm going to check off. But again, please, everybody hit the banner, hit the tap here, because everybody gets samples. Again, everybody gets samples. Yeah.
Okay. Do we have Dr. Moskowitz somewhere? I see him there. Here are a few of the questions. There we go. I'm going to start at the bottom and go all the way up to Dr. Moskowitz. Someone who works in assisted living, memory care, would it be effective on these patients if all they can do is sip water with the iorinse? Many aren't able to rinse, they spit, and definitely can't use a water pick. And you are on mute.
How's that?
Much better.
Good? Okay. All right.
Yeah.
Hi, everyone. Okay, so in the case of nursing home, particularly with people who are physically impaired or mentally impaired, If there's not one product that's useful, there'll be another product that's useful. For example, using these swab sticks, which are used frequently in nursing homes, they could either be swabbing iogel on the dentition, very effective, very useful. Or either that or saturating io rinse onto a swab stick or a sponge stick. Also effective, or sponge sticks are not available, then cotton tipped applicators. So yeah, absolutely useful in a long-term care facility.
How about lichen planus? This is another question.
Okay, so as Jason had pointed out, we don't make claims for treating lichen planus. I can tell you that there have been some very, very dramatic reports from dentists who have treated patients with lichen planus, and they've found excellent results. So you should bear in mind one thing, and which also gets to a couple of these other questions that are here too. One of the questions was, is it absorbed into the mucosa? You're dealing with something that is so safe for humans that the active ingredient is actually an essential nutrient for humans. So, as far as any absorption that gets through the mucosa, then you're working your way toward your recommended daily allowance of an essential nutrient. So there's no issue whatsoever. As far as there was another question about the pH, that there was that the dentist in the office had a concern about pH. The pH of these oral care products are generally in the area of 3 to 3.5 pH, and then which is the same pH as a glass of wine. And if you're drinking a 6-ounce glass of wine, if you have no concerns about that, you should have no concerns about this either. I can tell you personally that I run 300 milliliters of an oral care irrigant using iorinse concentrated irrigant in my water pick each night. And so I'm running 300 milliliters through my mouth every single night. I've been doing that for 5 years. And so I have no concerns, neither do the thousands of other patients who are doing the same thing.
Dr. Moskowitz,
yeah.
Just to add on to that, we actually did an in-house study. The pH actually changes the minute you put the rinse in the mouth anyway, because your saliva actually increases.
The saliva buffers the product. So even though in the bottle, what Jason's pointing out is in the bottle, the pH is 3 to 3.5. It's almost instantaneously increased when it hits the mouth and comes in contact with saliva, because the saliva raises it, buffers it up to a much more neutral pH very, very rapidly. Question, are there any antiviral properties of molecular iodine? You betcha there are. I don't know of a better antiviral agent. Take my webinar and you'll see some eye-opening evidence that molecular iodine is probably the most effective antiseptic agent on Earth, bar none. And I'll go even one further. How about even extraterrestrial? How about outside Earth? Because NASA decided when they wanted the most effective antiseptic product to take on board spacecraft, they chose iodine. Reason being because they had no idea what type of microbes they would encounter in outer space. So in 1955, they initiated using iodine on all spacecraft flights so that anything that they would bring back from outer space would not cause a pandemic. So you're in very, very good hands with this. Very good hands. Dr. M, there's a company using povidone iodine in applications for decay prevention. Does molecular iodine do the same thing? Jason has pointed, to answer your question, Jason has pointed out that the povidone iodine, the only biocidal species of iodine in povidone iodine is molecular iodine. That's why Jason was adamant about let's get rid of all the other iodine species, because they don't kill germs. Only iodine, only molecular iodine, present at 2 to 3 parts per million, is the only species of iodine in povidone iodine that kills germs. So we have, in our patented technology, we have boosted up the levels of molecular iodine to 30, 40, 50, 100 times that amount, stabilize it at those high levels, decrease all the other ones. So to your point, yes, povidone iodine is effective as an anti-caries agent, and molecular iodine is even much, much more so. There are plenty of studies that point to, particularly in early childhood caries, about povidone iodine being a very good anti-caries agent. And you can be sure that molecular iodine is even much better. And following this introduction of iRinse MR for oral mucositis and also for oral ulcers, and our next product that we're coming out with is iRinse AC, anti-cavity, which will have a dual-barreled effect. Just like all the other anti-caries agents, it will have fluoride to strengthen enamel, and also it will have high levels of molecular iodine to decimate strep mutans, so that you'll have a dual-barreled effect, killing the bacteria that cause tooth decay, as well as strengthening enamel. The only product to be on the market that will be able to do that. Okay, let's see. What about patients who report having an allergy to iodine? We don't have that much time, so I'm not going to go into depth with that, but I can tell you in almost all cases, there is no such thing as a true iodine allergy. You ask any allergist, and they'll tell you there is no such thing as a true iodine allergy. It's impossible to be allergic to something that your body requires. All right. So now that doesn't mean you can't be sensitive to higher levels of iodine. It doesn't mean you can't be sensitive to some other ingredients in an iodine solution, like a flavoring, or like in the case of povidone iodine, where they have polyvinyl pyrrolidone and a number of other ingredients. But things like, well, I can't take iodine because I have a shellfish allergy and it's caused by iodine. Not happening. Iodine shellfish allergy is not caused by iodine. It's caused by a muscle protein, tropomyosin. So no, that's a misnomer. It's replete in the medical literature that shellfish or seafood allergy comes from a muscle protein, a sensitizing protein, not from iodine. And as far as radio contrast media, many of which are rich in iodide, then it's also been shown that there is really ionic excipients in that media which cause these sensitivity reactions, which, by the way, could be severe and frequent. And also, even if it was iodide, there is no iodide in the molecular iodine oral care product, which gets to the point, which Jason had mentioned earlier, that we suppress the other species of iodine to either trace levels or so they're not even present at all. And that's also why our products do not stain, because it's the other iodine species that cause staining.
We're going to have to cut it short here, Dr. Moskowitz, because we have folks that are going to need their quiz. So please reach out to ioTech. Again, the banner's at the top of the screen. So if you've not done that yet, go to the top of the screen, enter your information. Now we've got a few people going on. We'll leave that up for another second here. I want to thank everybody for attending this evening. I want to thank ioTech International for supporting the program as well. Reach out to them with your questions and get your sampler kit here, because it's a great opportunity to sample every one of their products and $80, you can't beat that. That's a couple of trips to Starbucks anymore. I want to thank everyone for being here. And again, please reach out. We know we've gone about 10 minutes over, and I know a few of you are waiting for your quiz. So thank you so much. Good night now.
Thank you very much.
Okay. Good night. Thank you.